This is the most important season ever to get a flu shot. Typically, the hospitals get overloaded with flu cases in the wintertime. We got COVID out there also, so both of those together could certainly overwhelm our healthcare systems. So it's very important, more important than ever before, to get a flu shot this year. The symptoms are very similar, very hard to tell the difference. There's only one differentiation, that's that loss of taste or smell is more likely to happen with COVID, but only happens in a small minority of those. So the symptoms are very hard to tell. Get a flu shot that may knock out that as a possibility. COVID, we don't have a vaccine for that yet. Hopefully we'll get one before long. But the symptoms are very, very similar. So doctors are going to have a hard time distinguishing between the two. Now, most people with the flu or with COVID don't get that sick. They should stay home. That's the most important thing, and don't spread it to anyone else. But if you're really sick, you need to talk to your doctor. What would that be? If you're very short of breath, if you start to get confused, if you have chest pain, if you get blue lips, blue fingers, any of those symptoms, call your doctor or go straight to a hospital emergency room so we can take care of you. We have some drive-through clinics where you can go and get checked out there, and those are probably safer. Although I must tell you that our hospitals now, I think, are safer than any restaurant, any grocery store. We take lots of precautions. If you're really sick, you can go to hospital emergency room, you can go to doctor's clinics, but you want to call in advance. If you have some symptoms that are really worrisome, you shouldn't go to the clinic. You might have to go straight to the emergency room. So call in advance and talk with your doctor. Let us triage it. Let us help you figure out where you need to go that's best for you. There are many different flu vaccines available this year. Some of them have 3 different strains, some have 4, some are stronger than others. If you're confused, talk to your doctor, but in general, if you're over age 65, a stronger flu shot is thought to be important because the immune system doesn't respond as well. 3 shots are good, 4 may be better. The 4th strain is less likely to be the one that you'll get, so 3 is fine. Just get a flu shot. If you have any questions, talk with your doctor about what type is best for you. You know, people talk about the flu not being that big a deal. I've had the flu before. A cold virus is not a big deal. If you've had the flu, you know it is a big deal. With a cold virus, you're sick for 3 or 4 days. Maybe with the flu, you're sick for a week or 2, and you are really sick, so you want to get a flu shot. Are they perfect? No. I've had maybe a half a dozen cases every year. People get a flu shot and get the flu, but have a very, very mild case. So it does work. It is a good thing to get. You don't want to get influenza, just like you don't want to get COVID-19.